And as you are very much aware, it's anticipated that our infrastructure agreement will participate in the funding of traffic intersections and roadways around the area. We are partners in this together, as we have worked not only with the Escondido Police and Fire Departments, working with Dwayne and with Vic, but with all the other departments in the district that we serve who desire quick access to our trauma and emergency facilities. As the public lead agency, which we are required by law to be, PPH will work in partnership with you as facilities are developed, much as we are required to do in greater depth by the state and through their necessary approval process. With respect to the seismic issues that were raised, that if we had only spent $7 million back in 1999, all of the needs would have been met. I am disappointed that those individuals who spoke chose to take the dollar amount out of context of the whole report. The fact is that spending $7 million as the sole solution is simply not correct. What they forgot to share with the commissioners is that the $7 million didn't take into consideration all the architectural and design costs, or the mechanical, electrical, and plumbing improvements that needed to be made, or the movement of our power plant to support the seismic changes, or the number of nursing units that needed to be closed in order to accommodate those changes, or the accessibility standards that needed to be met, or the resultant increases in expansion of the towers that needed to occur because licensure standards have changed and the state requires that we bring them up to code. Further, that if we did, our bed capacity would actually be reduced by a third for a place that's an overcrowded facility already. Or the additional support service changes that would need to take place because of the seismic and piping changes needed to be made in the towers in question. Forget the simple fact of increased costs of construction over the last 6 years. As you can see, we spent a considerable amount of time looking at these issues, discussing them in depth before we made the decision to move. Now, I know that making the decision to accept us on the ERTC site was difficult for several of you. I know that, because you have desires and a vision for your city, much as our elected board has for our district, your district. We recognize, based on the growth of our communities and need for access to the 15 and 78 and land mass required, that sites were few. As you recall, we asked you what sites were available based on acreage, transportation, and cost requirements, and the ERTC was one of those sites. Well, we could rehash tonight all of the options and the locations and why they were good or bad for any number of reasons. Suffice it to say that I think we're all way past that. But we are very appreciative of your ultimate decision and indication to us a number of months ago that those who were opposed to our obtaining of this site would accept our moving to it based on the fact that it was pad ready, met our geographical and size and cost requirements. We know it was difficult for you. Tonight, we have the opportunity to take the next steps forward rather than back. So if I might, in the few minutes I have left, let me address the specific concerns which have been brought up to us by staff. I believe that through our efforts working up to this evening, we have crafted documents in a positive way that answer those concerns that you have and give you the assurances you need and that our board needs. With respect to the infrastructure development agreement for the ERTC site, we are prepared to provide $13 million to support the city's development of Citricata Parkway. That money will be put into an escrow account while the city completes the CEQA process and design and engineering work. All of the interest off of that account is available for use by the city, hopefully for addressing infrastructure development. Further, we are prepared to commit to the movement of our warehousing and purchasing facilities to Escondido so that the city can benefit from the collection of sales tax revenues on those purchases that will generate an additional $6 million over the next several years and millions thereafter. Added to the $13 million, you will have the $19 million your staff indicated as the total cost you needed to develop Citricata. We would make access available to the account by your staff immediately so that architectural, engineering, and design work could begin without concern as to where the dollars might come from to start the project. As the $19 million is amassed, it is only then we would ask you to begin and complete the construction of the roadway over a period of 10 years. In this way, you know that you have the cost covered up front, and we know that the road, which we both agree is important to the community, will be completed. It incentivizes you and us to move the project along. The sooner you get the funding, the sooner you can get the project started. As the mayor has pointed out to us in the past, we have a better opportunity to obtain monies from federal, state, and or local sources from a completion of Setricata from Valley to the 15 if we do it together. Otherwise, it may be many years before that happens, if ever. I think the solution works for you and will work for us. We have requested that should other funds for infrastructure are made available after the road is finished, and should such revenues generated be more than cost of the project, then the PPH board have the opportunity to receive up to the first $5 million of such back, recognizing that could be years from now. And when you walk through it, you saw that we also agreed to certain kinds of escalators. If the costs of materials are more, we understand that. We're dealing with that right now, aren't we? So we're trying to respond to your issues. In regards to the Memorandum of Understanding for the development of the downtown campus, I believe that we've also come up with language and intent that works for both public parties. Let me assure you that should you desire to have us in the community, and you do so by your vote yes, we are committed to developing with you our present Palomar site. We have specific needs for use of the space in the future and a desire to continue to serve the needs of the citizens in the area. We have committed to moving our corporate offices back to Escondido, something that has been of interest to you since I arrived 3 years ago. In order to effectively achieve this sooner rather than later, we will need to build an office building and parking structure to accommodate the increased number of individuals, particularly the approximate 450 to 500 new staff, let me repeat that, new staff, that will be there every day at the end of Grand Avenue from 8 to 6. Because remember, we still have to operate the place while we have that building there. We do need, and let me make that clear, I understand, we need an expanded, thriving downtown community. Since we need to continue to operate our present Palomar Medical Center till the facility is built, we need to purchase property to close a portion of the Valley Boulevard. In our agreements with you, we will begin the initiation of such, and within a reasonable period of time, as noted in your exhibits in the Memorandum of Understanding, will commit to making fair market offers, value offers to property owners for parcels needed based on the appraisals made. As a public entity, we are obviously, like you, not allowed to give public funds, so the offers must be reasonable and appropriate. We have also, and let me underscore that, have agreed upon language that will allow us to work with the city to acquire needed properties using all appropriate means to do so if such are required. We have incorporated into the memorandum the expansion of key programs and services, including our physical rehabilitation, behavioral medicine, urgent care, infusion and outpatient services, and other programs such as the creation of our Center for Advanced Surgery, Alzheimer's facilities, etc., solely dependent on our ability to move present programs to the new campus and receive state approval to operate the facilities there. At that point, we can truly begin to create the vision we have for the rest of the present campus as mixed use, retail, residential, office, and further healthcare development. As you are aware, for us to move forward, and as Mr. Brindle has pointed out, we will need to complete a CEQA review that would allow us to finalize our plans. I am excited about our prospects and what they can be in the future, and we've had a long tradition and history together. I hope that in your hearts you feel the same way. On behalf of the citizens of Escondido and the entire district, I ask you to embrace and support our partnership, and that we focus on what is really important. What is really important? The health and well-being of the people we both serve. Because I'm going to ad-lib here that 10 years from now, no one will remember this. They're going to remember the facilities that are there that support them. And when you need them, we will be there. The alternative would be disappointing, and I believe set this community back for years. On behalf of our board and our medical staff and our employees, I ask for your positive votes tonight on the documents before you. If not, our board unfortunately has to move on. It is easy to vote no or delay. and do what is politically expedient for the few. But it takes courage to stand up and vote yes and display the kind of leadership that the larger community you serve looks to and looks for from you. Mr. Haney, our legal counsel, our bazillion consultants, and everybody here are happy to answer any questions you have. And I want to thank you in advance for voting yes to support the creation of the hospitals of the future. Thank you.